morning, everyone. First, I'd like to thank our panelists for trudging out here with their reindeers and sleigh in this weather. Great job, guys. What I'd like to start off with is, rather than me give the introductions for them, I'd rather each one of them present and give us a little bit of background. So I'd like to start with Paul first.
Thank you. I'm Paul Smolovitz. I'm one of the founding partners at TM Capital Corp. We're a private investment banking firm. We focus on assisting companies in connection with mergers and acquisitions and raising private financing. And we do a fair amount in the healthcare space, and work in medical device, diagnostics, healthcare services, and healthcare IT.
I'm Rusty Ray. I'm one of the founding partners of 11 Team Partners. We are healthcare only investment banking service. Mostly we do sell side M&A. We work with small and middle market private companies, as well as small carve outs of large little multinational pharma. We work really across the board within healthcare. So biopharma, device, as well as healthcare services.
I'm Larry Chayton. I'm a managing director at Kaminsky Partners. We're healthcare investment bankers, and I'm also a general partner in a stem cell biotech fund that we should be in the market in the next couple of months.
Thank you, gentlemen. First, I'd like some feedback from the group here as to, based on the presentations that you saw, some feedback for our presenters, the positives that you've seen. So, Larry.
Yeah, I thought each of the presentations were very good. One of the things that I suggest be added is sort of the regulatory pathway and the time frame to commercialization and really go-to-market strategy. Most of them had pretty good go-to-market strategies, but it's really what are the assumptions behind the revenue model, and one of the presenters said, here's the hockey stick. So more how many and how are you going to get to that many purchasers?
Quick comment. Most of the asks that I saw were relatively modest for the potential of all. I would say if you get in front of institutional capital, VCs, they're going to ask you the question of what could you do with $10 million, and how do you spend that? How do we grow this faster with X dollars or Y dollars? I'd say be prepared to answer those questions. I would also say, go for a bigger number. You'll get significantly more interest from the institutional capital community. It's very difficult to raise $1 to $2 million from venture capital these days. So it's worthwhile thinking a little bigger and doing some distinction.
I think that companies that are being funded today are companies that provide game-changing answers in the healthcare field. And a number of the presenters today provided pretty compelling opportunities for increased patient safety, adherence, and improved efficacy. So those kinds of opportunities will be viewed positively by investors, and there didn't seem to be really extended runway for FDA compliance, huge dollar requirements for these companies to cash flow positive, and that too, I think, is what investors are looking at.
Well, having said that, what investors are looking to, can you give us, your viewpoints? We know in the third quarter of 2008, certain industries really flatlined. You couldn't get funding. So, but healthcare seemed to have still got funding even through the dry spell. Can you give us an indication, since where we're at in terms of funding for healthcare and what we foresee? Rusty, you want to start with you?
some of the larger strategics kind of filled that void during that period, either through their own funds or pockets of money, in their R&D funds and so forth, to kind of fund those Series A and even some Series B rounds of financing. I would say today, the venture capital world is coming back. I think most of the guys are still being quite cautious, and as a result, funding today is definitely a little more carefully and more thought out than maybe it was 4 or 5 years ago before the downturn.
Paul?
Well, I think as Rusty said, the IPO market basically shut down and continues to be generally closed today. So venture capital investors are forced to reserve additional funding for companies that they have either already invested in or are looking to invest in. And so the venture capital that is available is tending to look for opportunities in a later stage, and that is transferring the burden for Series A rounds to more angel investors and strategic parties, because big pharma companies, big med device companies have tons of cash sitting on their balance sheet, slow growth for their businesses internally, and they're looking for potential growth opportunities and new technologies to keep their stock prices.
So it's all about executing on a plan. Investors want to know that you've covered all the bases after a mechanism of action, right? So if you're a biotech pharma, mechanism of action just gets you into the game. Now, how do you reduce risk? And the components of risk include protocols, really good, well thought out protocol design, achievable endpoints that are smart, don't include endpoints for another indication that you're going to do 3 years from now. We see that. And reimbursement. Reimbursement strategy is critical. You want to do it early. Last December, there was an article that came out, 21 biotech companies got FDA approval, but didn't get reimbursement. No reimbursement, no revenue. So those are really the strategies. And also, what's the regulatory approval strategy? 510K is always shorter. PMA is longer. However, if it's a brand new device, you're kind of that leader in that device. So investors you need to tell investors how you're reducing risk and what are all the components that you understand need to be addressed to be approved and to start generating revenue.
So that goes to a different question, because effectively, in healthcare, there can be, depending upon what you're, whether you're a pharma or whether you're a device, the runway for funding could be much longer, much larger, or it could be shorter. And then you go to the reimbursement aspect of it, and the environment out there, and what's going on there. Thoughts? Just thoughts on those two aspects. Runway long, runway short, and reimbursement, ability to get reimbursed along the way in your decision-making process. You kind of alluded to that, but expand upon it.
So runway is, as Josh and partner at PeerTech, I like raising just that amount of money to get you to the next milestone, where the inflection point and your valuation is going to increase. So runway, know what your milestones are, and know what you need, how much you need to achieve those milestones, and what the it's all strategy. And then what's the next? Are you going for grants, which is the best because it's non-dilutive funding? And then the second part of the question is reimbursement. You have to get reimbursement. I mean, there's no other way around it. So understand the codes. So there's what they call ICD 9, which is now going to ICD 10. All that is a list of codes, reimbursement codes. So know where you fit, and have those discussions early with the payers. And then you've got two payers, right? You've got CMS, which Medicaid and Medicare, and then you've got the private payers, which are the Aetnas and Blue Cross and those. You have to do it early. If you're a biotech, pharma device, understand what the payers are looking for in terms of reimbursement approval. This way you can bake that into your current trials rather than waiting till NDA, for example, and then having to go back to the investors and say, well, great news, we got FDA approval. Not so good news, we failed reimbursement. At that point, you're no longer CEO. And so do it early, and the payers will tell you what they're looking for. So, if you Google a term, pharmacoeconomics, it kind of lays it out.
Rusty, in terms of what you like to invest in, layering on what Larry just said, can you give a little bit of feedback as to what space you like to be in?
We're not a principal investor, but I can tell you, in terms of kind of the runway, that is an important topic. And I have never once come across a client or company that has absolutely met their deadlines when it comes to pharma device development. They always succeed. And it always takes longer to market, it always takes more money. So we found that we're looking for, people say, well, we're looking for $10 million to do a phase 2A. And I say, well, no, we're looking for 15 to do a phase 2A because it's going to take longer. Patient recruitment is going to take longer. It just always does. People sort of underestimate just those little bit of hurdles start to add up in the time frame, and asking for additional money for that runway and having an understanding investor, a patient investor that can bear with those challenges as you go through this process is really important. So that's why I say, when I made my first comment about the ask of most of the companies seem modest relative to market potential, yeah, it's very attractive and desirable to fund just up to that next inflection point because it's less diluted, you reserve some valuation, all those great things. But just remember that, the last thing you want to do is get to that milestone and be a little short of cash and
Yeah, you don't want to be in that desperate state because you will pay. Paul, go ahead.
That last point, I think, is really key because you really need to override because if you are in that position where you're short of funds, not reaching your goals, that's where you find the most solution. So as I said earlier, I think that the money in today's market is really going forward therapies and opportunities where there's not a 5, 7, 8, 10-year runway. Opportunities where you can commercialize, you can be cash flow positive in a short period of time, attractive most capital.
Great, thank you. At this time, I want to open it up for questions.
Yeah, just a quick quick question. So I heard, it was Rusty, I think, you mentioned, asking for more money instead of less, because when you ask for, $1 or $2 million, you're kind of in the middle between angels and VCs, and you can't get any funding. What's the trade-off, though, if the company needs what it needs, so we need 2 to 3 million, but, to get into the VC world, they really want to do a little bigger deals. How do you balance that between what you really need, how much equity you're going to give up, and, those relationships? How do you do that?
Well, it's difficult. I mean,
And I'm sorry, I can't hear you, so.
sure. No, that's a really good question. You certainly want to be careful with solution. I think most venture groups, can be constructive in structure, and that's what it can come down to. Whether, if you come up with the right partner and they identify, well, we're actually going to need $7, $8 million over the course of the next 5 years, but you only need $2 million now. So, we've structured deals where you get money in at a certain valuation, you hit certain milestones, you get an uptick in valuation, and the next tranche comes in, et cetera, et cetera. So those things are achievable. You can structure those. But, I guess my point was that, to approach that community and sort of to be taken seriously and to get their attention, the ask has to be within their criteria, which, generally is going to be $5 million and up. It's very hard to get the attention of the institutional community turning things a little less than that. But I think structure solves your problem.
Great, thanks.
Well, just to add to that, also at the same time, I think part of the point is that you really need to have a very long-term vision, and that's where the money flow and showing that you can utilize more money flow, and also accounting for the X factor, which is, each one of them said, there is no doubt everybody underfunds themselves. They go over a longer time period. So you got to build that into your model with your ranges, and that's what basically they're saying.
We know we need another round after the 2 to 3, so what I'm taking from your suggestion is we ought to bundle them up and then negotiate the terms to tranche it out over the milestones.
Correct.
And that's a better solution. It'll get us upstream to the right capital investors, and that's a better.
You'll find yourself in front of
Absolutely.
a different group.
Okay.
Okay. Any other questions?
So I'm changing my ask from 2 to 3 to 5 to 7.
I thought you were ready at 10.
Yeah.
All right, Neil's going to close.
Okay, thank you, Corey, and thank you guys. I want to thank all you guys, Larry, Rusty, and Paul for joining us this morning. I also want to thank all the presenting companies. I'm not a scientist, but I thought each one of you really did an excellent job in laying out your business plan and maybe underestimating your capital needs a little bit, or a lot in some cases, but in communicating your message. I also want to thank again the Center for Advanced Sensor Technology at Stony Brook University and Larry Weber for your collaboration in this event, all of our sponsors for their contributions, and I want to remind everyone that our next Capital Forum again will be Friday, June 14th, right here at the same time, in collaboration with Cold Spring Harbor Laboratory. That's going to be a very exciting event. We look forward to seeing you all there, and please drive safely on the way home. Thank you for coming out today in this weather, and we'll see you soon. Again, all the presented companies will be available, except for David in the back for a few minutes, and if anyone wants to speak to them, feel free.